Good morning, Lake Providence and friends. I'm Dr. Linda Plummer Ward. Welcome to Worship in Purple, Alzheimer's Awareness Day at Lake Providence Baptist Church, August 18th, 2024. I'm going to read you a couple of Alzheimer's quotes. Though those with Alzheimer's might forget us, we as a society must remember them. And the second one, we remember their love when they can no longer remember. The health ministry wishes to thank our pastor and worship leaders for this opportunity to provide information, dispel myths, and to present risk factors and preventive measures that may help us as both patients and caregivers. Much of this information comes from the Vanderbilt Memory and Alzheimer's Center, as well as the Alzheimer's Association, and I invite you to their websites. Let's talk a few facts. Alzheimer's is a progressive disease that causes memory loss that disrupts daily life, causing problems with thinking and reasoning. In 2023, an estimated 7 million Americans aged 65 and older were living with Alzheimer's disease, and about 200,000 people under age 65 had younger onset Alzheimer's. This number is expected to nearly triple to 14 million people by 2060, with minority populations being affected the most. The economic burden of caring for people with Alzheimer's and other dementias is projected to reach approximately $345 billion. Some of the early signs and symptoms that you might see in an Alzheimer's patient include forgetting things that occurred recently, but they usually are not able to remember them later. Difficulty planning, problem solving, or completing tasks. Difficulty remembering what day it is or where they are, and they usually won't be able to think of that later. Alzheimer's patients may have trouble speaking or writing and may repeat the same things over and over. They misplace things but cannot retrace their steps to find them. Withdrawal from things or activities once loved may also be noted as they find conversations difficult to join and follow. Mood and personality changes such as confusion, depression, paranoia, fearfulness, anxiety, and the dangerous need to wander away, may occur later and must be controlled for their safety. Alzheimer's is not a part of normal aging. Aging increases the risk for it. All who are blessed to age may not develop Alzheimer's. Late-stage Alzheimer's includes trouble speaking, trouble swallowing, and trouble walking. Early onset Alzheimer's occurs in the age range of 30 to 50. Those symptoms may be different, and the cause is not known. Alzheimer's is not hereditary, but family members are more likely to get the disease. The exact cause has not been determined, but age, genetics, and lifestyle are included in the risk factors. There is no cure, but we can decrease our risk regardless of age. It is the 6th leading cause of death in the United States, a growing epidemic. Some of the risk factors: female gender, being African American, Latino, and Asian American, having type 2 diabetes, heart disease, being overweight in midlife, history of depression, cigarette smoking, brain diseases such as Parkinson's and multiple sclerosis, excessive alcohol use, and head injury. Some of the myths that you may have heard include that dental work with metals or silver can cause it, aluminum can cause it, and that young people do not need to be concerned. These are all myths. And remember, we can reduce our risk at any age. Another myth is that having a family member with it means you will get it too. That's not necessarily true. Let's talk about prevention. So here's your to-do list. Honor the body. Learn to prevent and manage chronic illness such as high blood pressure, type 2 diabetes, and high cholesterol. Feed the soul. Faith is important to reduce stress and for spiritual well-being. Balanced diet. Heart-healthy eating is also brain-healthy eating. That means limit sugar and saturated fats. Include lots of fruits, vegetables, and whole grains. Challenge your brain. Mental stimulation is important for brain health. So learn new skills, work crossword puzzles, do math games, anything that will stimulate your mind. Quality sleep. We should fall asleep within 30 minutes of lying down. Sleep through the night and sleep for about 7 to 9 hours. Avoid isolation. Social isolation is a public health problem, especially in older adults. Isolation and loneliness can cause depression. So stay connected to family, friends, and church. Be active. Regular exercise reduces the risk of chronic disease in general, and that includes Alzheimer's. Watch your weight by both increasing physical activity and improving your diet. Smoking and alcohol. Both negatively affect the heart and the brain. God bless you. Thank you for listening. I hope this information has been helpful. Thank you for worshiping with us in purple today. Love on an Alzheimer's patient and or their caregiver today. Remember them in your prayers this week. Caregivers, we love you. You're not alone. Take care of yourselves and reach out for help when you need it. From the Health Ministry, another ministry moment. Thank you.